Hi everyone, back to skin school. And today will not be a conversation about skin. I can tell you this because the man who I'm talking to has no interest in any good skincare. But he's a badass doctor. I was allowed to introduce him like this and so much more. Dr. Frank Lipman, I'm so excited to have you here today. And this is going to be fun. I already can tell. Thank you for joining us today in Skin School.
Thanks for having me.
Yeah, such a pleasure. You look like 20, so how do you do this? You want to know all your secrets.
20, I'm 67 years old. I'm an old man.
You look amazing, honestly.
All that Barbara Strum skin product, right?
Yeah.
That anti-aging serum.
I love that. I love that. I think that's one good part of good looking and younger, staying young as possible. And it's not about aging, because age obviously has a lot of wisdom and a lot of good things I find, and I'm going to be 50 tomorrow, so I have my thoughts about it. But how do you, what's your secret? I know you're also a big believer in anti-inflammatory lifestyle, and I think we talk a lot about the same things, but I would love to hear more from you.
Yeah. Well, I only really got into aging per se. I mean, I've been into health for a long time. I got into wellness and health when I left South Africa, actually, in the mid 80s. Actually, I got into alternative medicine in the early 80s in South Africa, because partly being disillusioned with Western medicine and partly being exposed to other medicines. But in terms of anti-aging, I only got into that maybe, I'm 67, maybe 10, not even 10 years ago. As you get older, you start, wanting to stay younger or wanting to stay healthy as you get older. So it's only, I wrote a book on longevity and aging a couple of years ago. And it was only when I started researching what can be done for aging that I got more interested in aging per se. So it's only probably in the last 5 to maybe 10 years aging, but I've been interested in health for a long time. And it's very similar, but there are specific things around aging.
I think it's very similar because, health, also means like a good immune system, means to withstand, virus, bacteria, whatever stresses come from outside. Then obviously bringing down inflammation, which is a big stressor and big culprit for aging and chronic diseases, especially the silent form of inflammation. It's not always that we see every form of inflammation, but the silent form of inflammation is probably what brings us really down. And so health is utmost important for an anti-aging purpose, of course, as well. So it goes together. But I would be very interested in your alternative medicine. Was it like the traditional Chinese medicine you were interested in, acupuncture, or medicinal herbs?
Well, my first exposure was in South Africa in the late 70s, early 80s, when I was doing my residency. I qualified in South Africa in 1979. But in those days in South Africa, there was apartheid. Apartheid means separate. You probably can understand that. It's a sort of German apartheid.
Yes.
But so in South Africa, everything was separate in those days during apartheid. So there were black hospitals and there were white hospitals. There were white schools and black schools. Blacks had to live in certain areas, whites had to live in other areas. So everything was separated. And I came from an interesting family, and I was always intrigued by African culture, and I always chose to go work in the black hospitals. And that was my first exposure to non-traditional medicine, because when we couldn't help the patients, the family used to call in the Sangoma, the local traditional healer. And I noticed sometimes that, the Sangoma would help some patients. So that was my first exposure, which sort of, sparked some interest, thinking, wow, that's interesting. They must be doing something right. And after my internship in 1979, I went to work in the bush for 18 months, where I was exposed again to traditional healers. And once again, I noticed that when we couldn't help the patients with traditional medicine, sometimes the sangoma would help, because I used to go, I was just fascinated by it. So I used to go check them out in those days. So that sort of piqued my interest. And then when I sort of went, before I emigrated to the States, I worked in a GP practice in Johannesburg, in white suburbia. And, once again, people were coming in and they were tired and they couldn't poop and they had headaches. And I had no tools as a GP, as a Western doctor. And I was just interestingly enough, the practice I worked in was like the hip sort of practice of Johannesburg, and the patients were seeing homeopaths. Homeopathy was popular in those days in South Africa. They were seeing the one acupuncturist there was in Johannesburg, and they were coming to me and they were saying, well, the homeopathy helped or the acupuncture helped. So I started sort of questioning or realizing that there's got to be some other ways to help people, because the patients that we couldn't help were being helped by these alternatives. So that sort of got me interested in the early 80s. And then I immigrated to the States in 1984. And, we didn't want to live under apartheid in South Africa. And when I got here, I had to do 3 years of an internal medicine residency just to get a license to practice in America. So I started my internal residency in the South Bronx in New York, because that's who sponsored me for a green card. And after a couple of weeks of my residency, I realized that I didn't want to be a doctor in America, because the medicine was very different. In South Africa, you had to take a good history, examine a patient. It was all about relationships and speaking to people. We didn't have the money to do all these expensive tests, whereas in America, there was nothing about relationships. There was nothing about speaking to a patient. It was about, quickly examining a patient, doing the blood test, doing an X-ray, and then getting something together to present to the professor the next day. So, and I remember coming home and saying to my wife, this is not for me. I don't want to be a doctor here. And there happened to be an acupuncture clinic attached to the hospital, Lincoln Hospital I was working at, because they were doing drug detox. So I said, well, acupuncture is interesting. I'd seen some good results, and I'm going to check out the clinic. And this was 1984, and I went to check out the clinic in this burnt out building, in this burnt out area in the South Bronx in New York in those days. That was 1984. And I walked into this big room, and there were about 30 to 40 addicts sitting quietly with needles in their ears. And I went, holy shit, this is interesting. These addicts who were pulling out IVs in the wards, and they were very difficult to deal with, they were sitting quietly with needles in their ears. And sort of that was the beginning of my real journey. I said, well, I want to learn this stuff, because there's obviously something to it. And I started doing time at the acupuncture clinic while I was doing my residency, got more and more interested in acupuncture and Chinese medicine. And after a while, I realized that the future of medicine would be some combination of the two, because at the hospital, people, we were treating acutely ill people. It was crisis care, broken bones, acute heart attacks, pneumonias, appendicitis, and it was wonderful for that. And at the clinic, we were treating the people who were tired and couldn't poop and had headaches, and acupuncture was great for that. So I realized that Western medicine wasn't good for the problems the Chinese medicine people were helping, and vice versa. So it was like a no-brainer then to see that the future of medicine would be some combination between the two. And that was the beginning of this journey that I went on, learning different techniques and modalities and trying to incorporate whatever would work to help my patients. And that's where I am today. And now in those days I was a quack. Now I'm a guru. So as I said, from quack to guru, and I haven't changed anything yet.
I love that. I have this similar journey. So I started in orthopedics, and I came together with a group of scientists, and I helped pioneering this treatment where you take the blood from a patient, create anti-inflammatory proteins and growth factors, and re-inject those into the joints. And that, together with acupuncture and herbal medicine, we would, treat people with osteoarthritis or bad injuries to take down inflammation and stopping the ongoing process of osteoarthritis, aging of the joints. This is where my background is. So I love that we have like the similar idea to combine both things, because for some cases you need to have a proper antibiotic, you need to have like proper medicine, but in other cases I feel like medicine can cause so much damage to your body. So if you have things which can be treated with acupuncture or with some herbs or whatever it is, some alternative medicine, we definitely should go for it, because I think, especially also if you keep taking Advil every day. My husband, for example, got kidney cancer from that. It's just so wrong to keep pumping all this medication in our system. So I think we need to balance and to also detox and to make sure our microbiome is intact, to make sure our organs can function in the right way. And I think that's a big part of anti-aging as well, conserving our organs in the original, and really keeping the medication really low, what we are taking. No.
Yeah, no, I agree. I think, as the metaphor I always use is, if you're driving your car and the oil light goes on, you just don't put a band-aid over the oil light. You see why the oil light went on. In Western medicine, we give drugs to suppress the symptoms. So we just put a band-aid over the oil light and we don't see why the oil light is going on. So then you start playing whack-a-mole, because a symptom will pop up somewhere else, and then you whack it with another drug and it pops up somewhere else, and you're always suppressing symptoms. So that's the first thing. So yeah, I absolutely agree with that. And that's what you start learning in other ways of treating the body. You're looking for why the oil light went on. What's the cause of the problem? And the other thing about drugs, and I agree 100% with you, I'm not against drugs, appropriate drugs, but drugs have effects. We just call the ones we don't like side effects. So this is a problem. I mean, once again, there's a place for drugs. They're just overused. It's the only tool we have in Western medicine is drugs or surgery.
Yeah.
And unfortunately, drugs are overused. So there is a place for them. I'm not against, if someone's having an acute heart attack, they're going to need drugs. If someone breaks a bone, they're going to need surgery. But I think we overuse drugs, and we're not very thoughtful about how we treat problems.
I think this is something we should learn today, really, to think twice before we take a painkiller, or maybe we try something else, maybe do something with alternative treatments. But if we see now, I think the mindset anyway shifts, because we just went through COVID. And I think people now understand how important our immune system is, and how important it is to nurture our body, our immune system, our health system, in order to withstand even those viruses. Because obviously the strong ones, had better chances to survive and to not take damage from it. And the weak ones have the problem. So I think it's really a mindset shift here. And doctors like you now get listened to even more, because we want to learn. We don't want to go in a hospital as a patient. We come to you as a healthy human being and say, what can we do better? What supplements should we take? What is it, what we can do to improve our immune system?
Yeah, I mean, I think unfortunately, even COVID is a good example. Everyone was focused on how we can treat COVID. And, not that I'm against vaccinations. I was vaccinated, but there was no one talked about how do we keep people healthy, what's going on with their blood glucose, or their metabolism, their sugar. Is sugar dysregulation a problem? Are vitamin D levels important? There were so many factors that we now know were issues. The people who did worse during COVID tended to be, or to have, sugar dysregulations or low vitamin D. So unfortunately in Western
Or
medicine,
nitric
that's not the
oxide
way. Yeah. And we
to
don't, sorry?
or nitric oxide for respiratory tract, by staying out of the sun, because everybody's so scared of the sun, why the sun
Exactly.
is so important. Yeah.
Yeah, so it's all these issues, you know, it's just because it's a way we look at the body. We don't look at how can we strengthen our bodies, how can we increase resilience so we can deal with viruses or whatever comes out. I mean, there's going to be another, you know, who knows? Is it this year? Is it next year? Is it in 2 years' time? There'll be another COVID. There'll be COVID 20 and 21. It behooves all of us to now try to stay healthy so we can deal with whatever is going to be, you know, thrown at us, because it's going to happen.
So, what is your daily intake? Do you take vitamin C every day? Do you check your vitamin D level? Do you? Now I want to know a little bit more about you. But vitamin D. What I mean, yeah. Let's talk about the sun for a sec, because I think especially in America, everybody's so afraid of the sun and skin.
Yeah,
I'm a skin doctor, so I'm dealing a lot with you know is it good to have sun exposure? Is it bad? I think we are not born as moles, so I think we need some sun for our functions, for our bones, for our vitamin D, for immune system, all these things. And
yeah,
we cannot just exclude ourselves from the sun in order to not get any wrinkles. I think there needs to be like a healthy balance. How do you manage your vitamin D intake or sun exposure?
yeah. So I agree 100% with you. Unfortunately for me personally, I had too much sun because as growing up in South Africa as reckless, I've got skin damage from the sun, but I still go, I mean, I think the sun, as you point out, has many beneficial effects. People are so scared to go into the sun, which is crazy. Now, there's a balance. Too much sun in the middle of the day or whatever can be harmful to the skin. Obviously, I am subject to that. But I am, a big believer in the sun as being something that's necessary for people. It has so many positive effects way beyond just vitamin D on our body. In fact, you talked about my sleep book. One of my biggest tips for sleep is to get some early morning sun, because sleep is a rhythm. So getting early morning sun is actually important for your sleep. I mean, we were born, we can't remove ourselves from nature. We are natural beings. So we do need daylight, we do need sun, as we need darkness at night. So yeah, I'm a big fan of the sun, maybe too much of a fan. But I think if you use sun intelligently, then it's has many, many positive beneficial effects.
Yeah, intelligently, I think is right, but it's also so good for our mental health. And
Yeah,
depending on your lifestyle, if you love surfing or whatever it is, do you want to take your lifestyle away, and this makes you unhappy, just to stay out of the sun? Obviously we need to check, for skin cancer. We need to have the right SPF. We need to check on our skin and make sure not going out in the midday sun. But
yeah,
I also find it's very interesting, and maybe you can talk a little bit more about it, because insomnia is obviously, it's just like one thing lots of people talk about, whether it's due to hormonal changes in menopause, if it's due to mental health issues and anxiety, if it's due to um, whatever it is. How can we, and one thing is, go in the morning sun, but what else would you recommend for a better good night's sleep?
well, I was always obviously somewhat aware of the importance of sleep, but never that aware of how important it was until I once again researched my book on sleep and, started learning how important sleep is to our health, including for aging. It's probably one of the best anti-aging treatments. And but what I did learn in Chinese medicine was that sleep is, in Chinese medicine, I got into rhythms. I was always into rhythm more from a music perspective, but getting into Chinese medicine, I sort of got a better understanding of body rhythms. And sleep is just a body rhythm, and albeit a very important body rhythm. And sleep is often, or a lack of sleep is often, a consequence. It's, once again, we're talking about the band-aid. A lack of sleep is usually a symptom of some other imbalance in the system. So if you're not sleeping properly, you can take a sleeping pill, not that I'm suggesting you do, but you're not dealing with why that's happening. And often, as you point out, can be hormones. It's often related to stress, but it's often related to an imbalance in our body rhythm. So one of the best things you can do for your body rhythm is to get some light, especially first thing in the morning during the day, and actually darkness at night. And unfortunately, what's happened is we sit under artificial lights late into the evening, and our body doesn't know the difference between natural light and artificial light. So your body's natural rhythms of secreting, like melatonin, for instance, which is your sleep hormone, doesn't kick in. So you disrupt your body's rhythms by being under too much artificial light at night, or reading your phone, or watching TV, or whatever light is coming into you is going to affect your body rhythms. So, being aware of light and darkness is very important. So because it's a rhythm, also you want to go to bed around the same time every night as well. So because once again, our body likes rhythm. So if you go to bed during the week at midnight and on the weekend at 8 o'clock, that's not good for your body trying to learn rhythm. So trying to go to bed at the same time every night is a good idea. And then you need to watch, stress you talked about. That's obviously an issue, but you also need to watch the foods you're eating. Not only can foods be pro-inflammatory, we'll talk about inflamm aging. There's a whole concept of inflamm aging. That's one of the main causes of aging too quickly, is inflammation. There's even a term, inflamm aging. But foods can also affect your sleep. If you're eating too much sugar at night, for instance, if you're drinking alcohol, for some people they don't metabolize alcohol, it can affect their sleep at night. So we now know so many factors that can affect our sleep. And I'll take it even one step further. We're now doing genetic testing. There's a genetic test I do, the 3x4 genetics, for instance, which actually tells us which nutritional pathways are weak, whether it's detoxification or methylation or inflammation. And it can actually help one determine what foods would be better, what supplements may be more helpful. And that can also be helpful with sleep, because if, for instance, if you're not methylating properly, or you're not detoxing properly, and you're eating certain foods in the evening and they're not being metabolized properly, it's going to affect your sleep. So sorry for that long rambling
No, it's so
riff,
interesting.
but it's fascinating. Yeah, it's fascinating. Yeah. So we're learning more and more now, and so we can refine each person's treatment protocol according to their blueprint, their genes, and their lifestyle, their epigenetics, how they influence those genes. So, we are now able to take wellness and health to a whole nother level. It's interesting times.
Very, very interesting. I love that you talk about it, because, there are histamine intolerances.
Exactly.
There's like
Exactly.
all of this, which,
So talk about histamine. That's very important, histamine, because we never realized how important histamine was. But now there's some pathways that you can have a gene or gene variants where either you don't break down histamine properly in the gut, or you don't break down the metabolites of histamine. And histamine is pro-inflammatory. We always think of histamine as you're getting allergies, but histamine is actually pro-inflammatory. And if you're not metabolizing your histamine properly, or you're not breaking down the metabolites of histamine, you because of those gene problems, you've got a problem. So yes, I think histamine is very important. I'm pleased you brought that up.
Yeah, and then you should not have avocado, tomato, wine, all aged
If
stuff.
Right, those are all
It's
high
important to
histamine
know.
fluids, exactly.
Yeah,
But for a lot of people, it's fine. A lot of people, it's not a problem. But if you don't have that ability to metabolize those foods, then it can be a problem. And if your microbiome is off and you're also not breaking down those foods, another problem. So it's a nice complicated web, which is quite fascinating and interesting as a physician doing it, because everyone's different. There's no one way.
But then there are also trends, especially when you spend time in Hollywood. There's a trend of, oh, I'm vegan now. I'm vegan. It's so
Yes.
amazing. And So as a vegan, if you're full vegan, you just don't even cook or prepare food. So you basically eat raw food at night, which then sits in your stomach. And while you think, oh, I have the plant-based diet and it's so amazing, it's so
Exactly.
good, it sits in your stomach, doesn't get metabolized, causes acidity, and acidity causes inflammation. So now we're back to, oh, I'm eating the right food, but the way and when you eat it is so
Exactly.
wrong that you come back to the same problem as if you would eat fries and your steak.
I couldn't agree more. So I'm not, yeah, so I
Yeah,
agree. There's definitely not one diet for everyone. And it's not only the foods you put in, it's how you're processing the foods. It's when you're eating it, it's who you're eating it with. I mean, if you're
yeah,
eating by yourself and you're angry, as opposed to eating, sitting around a table with your loved ones, big difference. So yeah, there are all these subtleties that we don't, especially in America. As a European, you probably know more that, I mean, eating around the table with your family and friends is such a
different.
important part of eating. So yeah, I couldn't
Yeah,
agree more.
In America, I saw my stepchildren growing up. There's hardly like sit down dinners. It's like, you bring that in because it's just such an important thing for social behavior and just for your rhythm, as you say. But I want to say one more thing, because you talked about microbiome, and as we all know, there's a microbiome in our gut, but we should not forget that there's also a
Right,
microbiome on our
skin,
skin. and
absolutely. Do you
and
have
when I
products
start,
for that, by the way?
yes,
I'm intrigued by the microbiome of the skin. I think that's the
yes,
future of skin.
yes.
I mean, unfortunately, I'm embarrassed to say I don't really know much about your product, but
No.
but the microbiome of the skin, I think, is quite fascinating, and I think no one's really talking about that. I don't understand why.
So the microbiome of our gut, meanwhile,
Yes,
everybody
yes,
understands that's important. So when we come to our skin, our largest organ, people
yes.
think they can put whatever they want on their skin. So
Yeah,
if it's glycolic or retin-A or some makeup or whatever crap it is you want to put on your skin, we just do it with no mercy, and we react with allergies, with redness, with burning, with tingling, with whatever, but mainly, let's scrub down our skin because that's how you do it. And I just want to say that it's so important for our skin, our largest organ, that our microbiome is intact, our skin barrier function are okay,
yeah,
that our skin is basically as healthy as possible, and that we take inflammation out and not causing inflammation, because aging causes aging, but not just aging. And one really important thing everybody has to understand about skin, and I talk a lot with scientists in this area, the skin is very much intertwined with our immune system. So there are dendritic cells which are quite at the surface. So whatever you put on your skin or needle in your skin or whatever it is burn down your skin, it has an effect on our immune system. And we should not overlook this. So it's important how you treat your skin, that you give enough hydration, that you keep your skin barrier, that you keep your microbiome, and that you take inflammation out. And one more thing I want to ask you about, because we do telomerase activation in our
yeah.
skin. Telomerase, I think
Oh, really? That's interesting.
that's
No,
how
that's
it
great.
started. Yeah, because telomeres, and this is probably one of the most proven anti-aging or aging theory, is the number of cell divisions. And us human have 40 to 60 cell divisions, whereas a turtle has 110 cell divisions, and a turtle gets to live over 200 years. So the correlation really is between the number of cell divisions. And for us, I think you would agree, it's so important that we go through all the numbers of cell divisions, and therefore we need telomerase activation. And maybe you want to explain telomeres, because that's, I think, so important to understand, no?
Yeah, I mean, telomeres are, it's like those ends of the shoelaces, and they become undone as we get older. So, yeah, protecting your telomeres is important. I had no idea, to be quite honest, of the connection between telomeres and skin. To me, the skin is just this outward manifestation of inside, inner health. So, but I've never even thought, I mean, I'm very aware of the skin microbiome philosophically, and I'm intrigued by it, but I don't see anyone really talking about it, which I find interesting. but I'd never even heard of telomeres and skin per se. I mean, obviously, I talk about telomeres and I write about telomeres in terms of anti-aging, but the connection between telomerase activity or telomeres and skin, to be quite honest, I'd never thought of. So thank you. That's interesting.
Yeah, it's like the whole concept of my skincare line is anti-inflammation, nutrition, hydration, telomerase activation. So to keep skin cells alive, to keep
Interesting.
skin cells to go through their cell divisions and not burning them down with glycolic or acid peels or lasers or whatever. We actually want healthy cells, performing cells, and then you get healthy skin and you get a transformed skin.
Interesting.
And healthy skin also is not so upset when you go in the sun. If you have compromised skin with, unhealthy skin layers, no microbiome, no skin barrier function, oh my God, the skin will be so suffering when you take it into the sun or you have it bombarded with pollution or HEV light from the phones or whatever it is. But, if you keep your skin healthy, that's one step, further to having like let's say normal lifestyle, being out in the nature and not worrying so much and have just, wearing a SPF, but, being a
Right.
little more generous.
Makes sense.
And with the telomerase activation, all the science and concepts I had for the skin, I said I need to have these telomerase activators for every cell in our body. So I started some supplements where I put telomerase activators in. I put in glutathione, astaxanthin, superoxide dismutase, like good antioxidants, but also ingredients to build hyaluronic acid in the body. So not the usual supplements, little more innovative and cutting edge science.
Right. So that the next thing you're going to have to do is now you'll be able to fine tune. I mean, I suppose this is complicated as a, sorry, my head's going, yeah. But you can actually probably have targeted treatments for certain where certain people's weaknesses are.
Yeah.
But that gets complicated.
No, but
So,
that's definitely
yeah,
what's been worked on, and where, we're finding ways to really address what you have with your gene testing. I think it's interesting for people to understand the weaknesses in order to react. And
yeah,
I think it's so fantastic what you're doing. You also developed this cleanse. I would like to
right.
hear more about, if you have a little more time.
Yeah, no, I've got lots of time. I'm enjoying this. Well, the cleanse, I started doing cleanses on people many, many years ago. When we started doing cleanses in functional medicine, probably in the 90s, I can't remember exactly, but it was more about supporting liver detoxification. But then what I realized with my patients, I can't even remember, it's probably 20 years ago, I don't know when I started doing it, more gut stuff. I realized that when people were coming in and their microbiome was off, they were bloated and they're gassy and they had what we're now calling SIBO, or they had irritable bowel syndrome, but their
Right.
microbiome was off. And until you corrected that, they were getting fatigue and inflammatory symptoms, whatever it was. So I started incorporating antimicrobials, herbs that kill bad bacteria, for lack of another term, in the gut. Because I noticed that people would either have what we're now calling SIBO, small intestinal bacterial overgrowth, or what I see a lot more as well, SIFO, small intestinal fungal overgrowth. So I started using herbs that have antibacterial, antifungal effects and started getting really good results. People, once their gut was better, they started feeling so much better. So that's how the cleanse developed over the years. And and now, I have a cleanse with, I'm chief medical officer as well. And apart from my practice, I'm chief medical officer at the Well, and they have a line of supplements. So we put a cleanse in there because I used to have my own line years and years ago. But so we started a cleanse there, which is basically antimicrobial herbs, a powder which supports liver detoxification function, and then avoiding foods that are pro-inflammatory.
I love that. I have to look further into all of the things you're doing, and I don't really want to share you with anybody because I'm enjoying this conversation so much. But there are a few of our
Well,
participants
we'll have
today
another one. How about that?
who wanna dial in, and they probably have
Sure.
some specific questions.
So I think we have Jessica Job Maddy on the line. If you want to just turn on your camera and
Is that the Jessica that I know?
Jessica, you know her?
Hi. Yeah, I'm a patient of Dr. Lipman's. I am having trouble turning my video on though.
Is it on the left, down on the
Yeah,
left?
I'm clicking. It's just not going.
Okay.
Anyway, hi, Jessica.
Hi, Dr. Lipman. How are you?
Good, and you?
I love that.
But thanks, Dr. Sturm, for taking my question. This skin microbiome conversation you're having is really of particular interest to me because I've been working with Dr. Lipman for the past year, kind of repairing my gut and just overhauling my diet. We found that a low carb and low sugar diet in particular works for me. Sometimes I'll go to the store, I'm in Whole Foods, I'll pick up a body moisturizer and you smell it and it just smells super sweet. So I'm at this point where I'm wondering, you know, I know toxic chemicals, obviously you don't want to put those on your skin, but how much do carbs and sugars in your skincare products impact your overall blood sugar?
That is a very interesting question. I first of all, I wouldn't know why carbs and sugars should be in skincare.
Yeah.
That sounds weird. Also, I mean, let's quickly talk about a little bit about, you know, this idea of like whole foods and organic. And to me, organic is like a big marketing term, which to me personally doesn't mean anything because, you know, organic means in every country something different. You know, organic in some countries still means that fields are spread with pesticides, and, you know, and that's the one thing. The second thing is basically, you know, organic skincare, which probably only is sold at Whole Foods, is basically you take an herb and you put it in a jar, and mostly it would be an oily formulation just because there's no step in a lab where it can be made water soluble. So I think the step in a lab, you know, I'm using all herb, my skin is all herbal, but we synthesize our herbs in a lab and make it, you know, for example, purslane we use a lot, which is also telomerase activating. We bioferment, you know, it's biofermented, and we make the herbs reliable in concentration. We make them, you know, not viral, so you can't react to it, and we make them safe to use, you know, and we bring the full effect of a herb out. So just saying, okay, this is like a whatever Viper's buclose oil, without really taking this herb and making it valuable doesn't make any sense. So I would suggest not necessarily looking for these things at Whole Foods and really going a little bit more into science-led skincare. And I'm happy if you want, you know, that we can do another FaceTime consultation and see what really the needs of your skin are, and what would be a really good skincare routine for you.
Yeah, I mean, I just want to say, I think that whole concept of the skin microbiome is fascinating. And I think if you can, there's obviously a way of, I mean, I don't know how, and if it's possible, of correcting someone's skin microbiome and their skin gets better. It just makes sense. I have no clue how to do it or whatever, but it just, you know, philosophically, conceptually, it's, to me, it's just common sense.
Yeah, we're bringing out a whole line just for that.
Interesting.
I probably shouldn't say that, but that's basically ready to go. But, you know, you're absolutely right. And, you know, what makes a microbiome suffer is already like hot water. If you take a super hot shower, the microbiome is already, you know, or if you use a fragrance, you know, fragrance on your skin, if a cream has fragrances, it shouldn't be in there, you know. I think like anything aggressive, and then not to talk about glycolic, retinol, acid peels, hydroquinone, all these, you know, aggressive, and skin targeting ingredients disrupt your microbiome. And as soon as it's like seats in a movie theater. Every bacteria and virus and fungus and parasite has their own seats, and as soon as some seats are empty, there could be an overgrowth of one bacteria, one virus, or one fungus, and then there's a disbalance in our microbiome, and that messes up our skin, and we react with sensitivity. Sensitivity is one of the most recent complaints when people go to a dermatologist. And this sensitivity of your skin is mostly self-inflicted. It's not even by genetics or whatever. It's just what you put on your skin, because the market is so oversaturated and so much aggressive ingredients on the market which just don't belong into skincare.
Okay, thank you. I mean, for sure, I've been careful about what I put on my face. Apparently, after this talk, I have a little more studying to do, but I guess I just, don't worry about like what kind of bath bombs I put in the bath normally until, further inspection. But now I'm looking forward to that line you weren't supposed to talk about.
Thank you, Jessica. It's so nice to meet you without seeing you. So I'm looking forward to having another chance, possibly. But but you know what, kids already, if you have children and, they're like this bubble baths, what kids love, and I have a 7-year-old, it's really not the best for your skin. The best would be to put a gallon of milk in your bath, and have a nice milk bath and not have the bubbles, and be really careful with, shower gel. I created all these products in our line just because there shouldn't be any fragrances. There shouldn't be bad sulfates or tensides or whatever is in, shampoos, conditioners, or, bathing soaps. So we should really be pay attention to what it is we put on our skin, Also, the pH varies so much. Our skin's pH is slightly acidic, and if you think about our genitals, it's very acidic at a woman's genitals. And if you use soap, the pH of a soap is 9, whereas your vulva vagina is like 4.5 or something, and it messes up the pH. And it's not just the microbiome; it's also the pH, which then leads to urine infections or whatever it is. So I think we have to pay attention how we treat our skin in every area of our body.
Thank you.
Nice to meet you.
Okay, next we have Shaw Pierce. If you want to just ask your question, turn your video and microphone on.
Yes.
Shaw.
Hello.
Are you also a
Dr.
patient of Dr. Lipman?
No,
I'm not. No, I'm not.
Not yet. Not yet.
Not yet. Exactly. Very nice to meet you. My name's Charlotte. I'm calling from London in the UK. And my question is, I'd love to hear your opinion and thoughts on adult acne, and if you have any few key steps to combat it.
That is a good question for both of us, I think, because first of all, I think, when we're younger, we get put on all kinds of hormones to prevent from acne, and then you get into your 20s, and then you think, oh, you want to get off your hormones, and then all of a sudden everything flares up, and then then you have this hormonal imbalance, and mostly it's mostly is a overload of our male hormones, and not just that. What can cause acne? It can also be caused by pollution, for example. If you're in a big city, and London is obviously very polluted, you have to find a pollution protection in your skincare to keep out the pollutants, because it very often causes acne. And then obviously you check your diet, your what you eat. If you eat a lot of processed meat, which is mostly hormonally treated and treated with antibiotics, or even dairy foods, which can cause the disbalance and can cause acne breakouts. But the biggest misconception in treating acne is that you should dry out your skin. And mostly if you go to a dermatologist, they give you all this like harsh ingredient which on top of your acne now destroys your microbiome, dries out your skin, and makes your skin super, super sensitive and vulnerable. That's exactly the opposite of what you want to do, because if you have a kid at home and they fall and, you know, the knee is bleeding, you don't put the kid in timeout. You hug it, you love it. You do the same with the skin. You repair the microbiome, you bring up the hydration level, you soothe irritated skin. So all these like tasks should be really done with a proper skincare routine. And I created the clarifying line and my line. And if you're in London, I would love for you to go to the Mount Street store and spa and get a facial and really experience and have our team look at your skin. And it doesn't mean that you shouldn't go to a dermatologist, but before taking any, you know, ointments and strong medication, you want to really take care of your skin. So your skincare routine comes first, yeah, to really help your microbiome. And then you go into, you know, certain ointments, punctual, or if your doctor says at one point, you know, now your acne is going on too long, we give you medication, you still need a good skincare routine, yeah? But not aggressively targeting your skin, especially not by your own choice, you know? I think it's just the biggest misconception. Dr. Lipman, you probably have a whole big idea about acne too, no?
Yeah, often from my perspective, sure, acne, especially in adults, I mean, there's obviously some hormonal component, but it's the microbiome. You've got a, you know, a microbiome that is out of balance can, you know, what happens is you get these, whether it's bacteria or fungi that release metabolites that can often go through what we call a leaky gut, and then they can create inflammation anywhere. So acne is often a microbiome problem. So you need to correct, I mean, I have no clue with it, but as a general rule, I always look at, you know, what's going on in the gut for acne. Too often, people have been given antibiotics for acne. So you go to a dermatologist and you've got acne and they put you on antibiotics. And I would say so many people that I see who come in with all sorts of problems are because they were put on antibiotics for the acne and they were on antibiotics for long periods. So because the antibiotics will kill any bacteria that's sensitive to it. So it may help your acne short term, but long term it's a problem. So the first thing I look at with acne is the microbiome and how to correct the microbiome. You know, yes, it could be hormonal stuff, and obviously there's a local or, you know, skin treatments that need to be done, but from a systemic perspective, you look at the microbiome from my perspective, or I'm always looking at the gut.
I think that's the gut microbiome and also the skin microbiome, because what I said with the movie theater, the movie theater, as soon as you use ingredients in your skincare which can, you know, disbalance the microbiome, then certain bacteria can take over and can, you know, cause even, you know, acne on the local side. So but I agree with you on the antibiotics. I agree with you on what you said. I think there's like a big misconception, and I think also that, you know, going to, and this is nothing against dermatologists, but I think we need to also bring some more alternative medicine to a dermatologist, because I think dermatologists very, very quickly, you know, go to antibiotics, cortisone, lasers, acid peels. So there's a lot of like very aggressive targeted treatments where we could maybe go and do something about corneotherapy and, you know, be a little more, you know, on the alternative side there. I think it would be good if there would be more balance between school medicine and alternative medicine.
Very interesting to hear, because I've been suggested products like retinol, acid peels, and etc., and I've not what to do. Okay, I will take that and I will remember that. Because
come to Mount Street. We will, you know, my team will get in touch with you so we can, you know, make sure you get the best treatment and the best, you know, experience and advice for your skin, and we will fix it. We so far fixed everybody, so we're good.
Sounds positive. Thank you so much for your time. I really appreciate it.
So nice to meet you.
Nice to meet you too. Thank you. Ciao.
Ciao.
Okay, I think we have time for one more. So we should have Deanna Deshay, if you'd like to just ask your question, Deanna.
Okay, hi.
Hi.
I had a question about gluten. So I was gluten-free probably for 8 years. And did some blood work and figured out that I had actually 0 gluten allergies. So I kind of went crazy with the gluten, and I've been eating it like crazy. So I wanted to, you know, when you Google stuff, it's like some people say it's okay, and then some say it's not. And I'm wondering what effects it has on the skin, or if I should stop eating the gluten, or if you don't have like a gluten allergy, is it still bad for us?
I'll answer that. I'll start off on. I'll start.
Your
Yeah,
question.
I think you're American. Most American gluten seems to be a problem for most people.
Yeah, I think it's worse. Yeah.
So you know, I know for myself, I can go to Europe, and a lot of my patients say the same thing. They'll go to Italy, they'll go to France, and they'll have the bread and whatever, and they don't have a problem. So that's the one thing.
Yeah.
What I will say is the traditional blood tests that are done for gluten, the celiac test, picks up just 4, I think, antigens in the gluten. There are many more antigens. There's something called a wheat zoomer that we do. It's a skin prick you can do, which picks up about 13 different antigens in the gluten. And my experience has been, because I do a lot of these tests, that almost everyone comes back with some of those antigens that they're making antibodies, so they're positive. So most people tend to have some type of sensitivity to gluten. And you know, some people can handle it and some people can't, but as a general rule, I find most people do better without gluten. Now, I'm not saying you never eat gluten. I eat gluten, so I love gluten. It's not that I'm not going to say no to a good French croissant or whatever, but I think it is pro-inflammatory for most people, not for everyone. So you got to, but it may not be a problem, you know, it's sort of up to a level may be fine for you. Above it, I wouldn't go crazy on gluten. I don't think it's necessarily a healthy food. Most people will probably do much better without having gluten. Having said that, gluten-free products are often high in sugar and crap and all sorts of things as well. So just because you stop gluten doesn't mean you should eat, you know, a lot of these high sugary carbohydrate gluten-free products. So, you know, I think just because they did a blood test and you don't have celiac doesn't mean you're not sensitive. So there's something called a wheat zoomer, that's a finger prick, which will give you a more accurate.
That's what I did. I did the intolerance, and you know, I was eating a lot of things. I'm vegan, so I was eating a lot of things like kale that all showed up. And so I did the test.
Well, when you eat a lot, so food sensitivities are different. Food sensitivity tests aren't that helpful in my experience, because when you're eating a lot of the same foods, they'll come up positive. The food sensitivity will be what's going on in your microbiome will affect the food sensitivity. So I'm not a big major fan of food sensitivity tests per se. In certain conditions, yes. But there's something called this wheat zoomer, which is actually a little bit more accurate than food sensitivity. And for instance, if you got a leaky gut, it'll be worse having gluten. If you don't, it's better. So there are many different factors, but I would probably encourage you to either stop or cut down on your gluten, and rather have it when you go to Europe.
Right. Okay. Thank you.
That's my take on it. I mean, I'm sure it's got effects on the skin.
But I think,
I was wondering,
especially American food, you know, when I'm in America, it's always tough on my stomach. I get gastritis. I have no big tolerance.
I always joke that we're slowly being poisoned. It's just, I mean, I eat like really clean, organic. I don't eat a lot of packaged stuff, and I still have so many issues. And when I travel, it's like I can eat anything, everything all day and no issues. It's crazy.
I have the same experience, and it's scary also to what do you
just can't eat anymore.
Yeah.
You know? Yeah.
I think there's a lot of gene manipulation being done, and the apples are all looking perfect. I like to find the apples who are not perfect.
Yeah, right. Yeah, that's true. Yeah, thank you.
Okay, nice to meet you.
Yeah.
Thank you so much for joining. Frank, it's been such a pleasure. I'm such a fan. and I want to have more conversations with you. I want to also do some testing with you. I'm very, very intrigued with all your work, and yeah, it's been such a pleasure to finally have this conversation with you.
Lovely to chat to you too, and I'm intrigued by the skin microbiome, so that'll be good.
I see you walking your bathroom after our conversation, slamming the super anti-aging serum on. I can already tell that's going to happen.
I actually do need it, but I never put anything on my skin. I probably should, but anyway.
No, you look amazing, but you will see a little transformation even there.
Okay, good.
Okay. Give
Anyway,
my love
lovely
to
to
your
meet
wife.
you. So are you based in Europe, or where are
I'm
you?
based in Europe. Our headquarters is in Germany, and yeah, I'm in LA a lot, but our base is in Germany and London. Yeah.
Okay.
Where are you now? Where are you now?
In New York.
Oh, nice. Oh, good. So I will send my daughter over to you if that's okay.
Of course.
She's 26 and has a bunch of issues. I would love for you to
would be a pleasure.
Thank you so much. Thank you.
Okay, thanks, Barbara. Lovely talking.
So nice talking to you. Big kiss.
Bye.
Bye, everybody.
Bye.
Thanks for zooming in. Ciao.